And so we've been working with the County of Sonoma. It's a collaboration. And it's important that we continue this dialogue about COVID and what's going on with COVID. So Ms. Silvia Lemus from the County of Sonoma comes over and provides us with the latest data, the latest numbers. And today was an important day for us to talk about this, for me at least, from the point of view that we just had the 4th of July, and it takes a few days, and then we start seeing a higher number of COVID cases. What information do you have for us today?
Thank you so much, Rafael, for having me today. So I'm here to share our current metrics for the week on COVID. So first of all, right now we're seeing 35.3 new cases per 100,000 in population. So it looks like it's gone down a little bit. But our case rate for unvaccinated people is still high. It's 65.8 per 100,000. And for vaccinated people, it's 31 per 100,000. So there's a big difference whether you're vaccinated or not. And so our positivity rate is right now at 16.6%. And our metric and our equity metric positivity is 18.4%. So we're still there. It hasn't really come down so much. And and we're seeing still a lot of propagation in the community. You know, we know a lot of people that are still getting sick with COVID. Let me give you some other data here. As far as vaccinations, we now have about 83% of our total population that's eligible, not total, but eligible population that's fully vaccinated. That means that they have gotten the regular vaccine and their boosters if they're eligible for it. And the people of the residents who are eligible to receive boosters, about 65% of the eligible have received their boosters, and that's if they're eligible for the first or the second. So we still have a little work to do, but we are kind of getting there slowly. It's really slowed down. So I think now we're getting down to the more difficult to reach and difficult, or people that don't want to get vaccinated, but it's just so important because it affects so many of our numbers. Like, for example, our hospitalization rate right now, we have 40 people in the hospital, one in ICU. And out of those, I would say 99% are unvaccinated in the hospitals. So, so those are the impacts if you're not vaccinated, is that you can end up in a hospital if you have underlying conditions or other reasons and you get really sick.
Definitely. And it's interesting, again, that people still choose not to get vaccinated. And some of us, right, are familiar with people who haven't gotten vaccinated, and now they have these chronic conditions of coughing or, you know, whatever the situation it is. Maybe they get tired really quickly. They don't have the energy to get out of bed. That's just the consequence of doing this. And yet some individuals are still choosing not to get vaccinated. But the numbers are slowly, right, increasing. And this is important because of something that you mentioned earlier, and I know you're going to mention a little bit more, but now we have to get to the point that we need to recognize that COVID is here to stay, and that it continues to evolve, but we need to get used to COVID as a permanent fixture in our lives.
And Rafael, one thing I want to also mention is that percentage and the number of cases, that may not even be correct, because there's a lot of people out there that are either not testing or maybe taking the home antigen test and not reporting the results. And so then the numbers are not, you know, they're skewed. They're not really, it's not really showing the reality of what we're facing. Because I know that we both know a lot of people, you know, a lot of people that in their families, there's a lot of people sick in their families with COVID. I've seen some businesses that are saying we have to close for the week because we don't have staffing issues. And a lot of times when they say that, it's because they don't have enough staff because people are sick and they can't really staff their business operation. So it's really important for also people that when they test, they report it. And on our website, socoemergency.org, under testing, there's a form that they can fill out there to let us know about what their home test results were. And yes.
Yeah, so again, what we don't want is for people to lower their guard thinking that the numbers that show up on SOCO Emergency are necessarily accurate. And they're not accurate, not because you don't intend to have them accurate, it's just that people are not reporting them. And so as I was mentioning, I know two families that are sick, and we're talking about most of the two families are sick. So this amounts to probably 11, 12 people. And those are 11 to 12 people that would show in those in that report at SOCO Emergency. But because they never reported it to the county doesn't know that those people are sick. And how many other families, because of the 4th of July, are testing positive, but
Mhm.
because the home tests are available for everybody now,
Mhm.
they just don't report it and they just deal with it at home
Yes.
unless they actually have to go to the hospital. And so you may never know that they had
Mhm.
COVID.
Yes. And here at the county, we still have vaccination sites available,
Mm.
vaccination clinics and testing clinics going on. If people go to SoCo Emergency, they can get the calendar, this information. But for example, we have the Roseland Clinic on Sebastopol Road that's available from Tuesday to Saturday. And we just now were informed that starting next week on July 13th, the West County Health Center is going to hold a vaccine clinic every other week for all people, including children from 6 months old and older. And
Mm.
so everyone that's eligible will be able to go there every other week. They'll have a vaccine clinic for ages 6 months, 4 years old and older. So this is at Gravenstein, the Community Health Center out in Sebastopol, and it's going to be open from 3 to 5 on different dates. So you might want to maybe go on their website or check our socoemergency.org calendar for the dates for that. One of the things that we're learning too is that the BA5, we're going to be having variants. Like I said, COVID is with us, and we're going to be having variants and changes, and we have to learn to protect ourselves and our families and kind of and live with COVID in the future. So that we have found out is that the BA5 is now the dominant variant here in the US. It's rapidly spreading. It's an Omicron subvariant called BA5. And in the US, as of Saturday of this last week, BA5 made up about 54% of all the cases in the US were BA variant. And so we know that that's kind of like the strong one right now. And there's a lot that we don't know. We don't know whether the antibodies from previous infections help evade it or help fight against it. There's a lot that we still are learning about it. So that's what's really important for people to know their status, to get the vaccine, to be tested, to report, just so that we know where Sonoma County stands in all of this.
Yeah, definitely. So again, testing is available, vaccines are available. Let's make sure that we have the right numbers in regards to the number of people testing positive. And at the same time, again, get vaccinated. We are hearing of more and more younger children who are getting COVID, and some are asymptomatic. But there's others who, again, we don't want those children to end up in the hospital because they're not vaccinated when the vaccine exists. And
Mhm.
I know that there's a certain level of anxiety among families and parents, but you know, to a certain degree, that is your responsibility as a parent
Mhm.
to take and make the right decisions for your children. And so it's important. And the other reality is you may choose not to vaccinate your child now, but in the very near future, you know, the state
Mhm.
will require all children to be vaccinated. And as a result of that, do it now and hopefully prevent your child from getting the virus,
Mhm.
or do it later. And maybe by then, you know, there may be some health issues related as a result of your child having COVID at some
Mhm.
point. So it's really, really important. And that brings us to this other piece about, you know, COVID money, as I call it, from the state, from the feds probably, is going away at some
Mhm.
point. And how's the county going to continue to work
Mhm.
with people?
Yes, well, we just last week put out a transition plan. So some changes are coming to the Health Services Department and how we put forth our programming and services around COVID. So I wanted to share just a little bit about that transition.
Mhm.
So we know, like I said earlier, COVID is endemic. That means it's going to be a part of our health landscape from this point forward. Different variations may come that we might have to take other vaccines on a yearly basis. We just don't know. But the scientists and the in the federal government are working on it right now to make sure that we have what we need for the future. So we know that it requires strict monitoring, and the health department will continue to kind of monitor that. And we do expect continued cycles of mutation and spread in the community. But COVID will become a part of our ongoing, everyday ongoing work, both at the county and just countywide. We do see high levels of protection in the community because, having like 83% of people that offers a level of protection. But we will see decreased resources, and we'll have to organize appropriately within the health department and realistically as well. We're going to continue to focus on those populations who still face the greatest threats from infection. One of the things that we're trying to do as well is we're going to try to focus equity in our decision making when we're addressing COVID in the future. So we're going to use community engagement, and the community voice is going to be a critical part of our programmatic areas. And we're making a commitment to equity and to serving the most vulnerable in our community. So we're going to continue with that unwavering and a renewed kind of commitment. And we're looking at multiple, to create multiple avenues for involvement and mechanisms of community voice rather than just one focus on COVID. So not just the county, but different organizations kind of all working on COVID. The transition from the COVID response team is right now what we're doing is we have let some staff go, like maybe like a third of the COVID team, go. And then other staff, we have kind of incorporated them into existing units at the health department to do similar work. So there are some units that do similar work that we just went when COVID and the pandemic started, we pulled and we built up a special unit. But now we kind of transition some of these people back into other units like the epidemiology, disease control, all these different units that normally operate in the health department. We also have seen a drastic reduction in funds, both state and federal, for community COVID response. And so that's one of the reasons that we're also having to take this step so that we can still operate efficiently for as a health department for our community. So our response is going to be to evolve and narrow our focus. And the evolution is going to be reflective of the ways in which COVID has impacted functions in our department. So that, as I said, we're not sure yet on the funding. The state and federal can still come through and give us funding. So this may not, we may be able to kind of increase our sources, but right now we're trying to be conservative to be able to protect the ongoing functions of our health department at this point. But in the future, we're focusing on populations. We have to acknowledge the intersectionality between groups and those who have been historically impacted by our systems. So at risk of severe outcomes, we know are elderly and immunocompromised, people in congregate settings like in shelters, the unsheltered, the uninsured, and then most people in our communities are protected right now against the worst outcomes of the virus. So 83% that have gotten the vaccine are protected. But we still have some of these other focused populations that we're going to be focusing on. So like, for example, testing infection is going to move into our disease control unit. So we're doing those kind of changes, strategic changes of our existing COVID work into the already existing health units that are doing the work. Vaccination, we're going to continue to do vaccination and work with our state and federal partners to do vaccination at all levels necessary. And we're going to continue to seek equity and parity in vaccination rates and focus on up-to-date status of those that are more susceptible to the illness. So we do have like our COVID, right now our COVID and planning operations, our plan is to fold them into public health preparedness section to our overall public health preparedness. So we're just kind of looking at all the different elements of our COVID and seeing where this work would fit appropriately within our overall health unit is what we're working on right now. And then including, we're going to really try to boost up our community outreach and engagement team. So we're going to try to build a bilingual, bicultural workforce. We're going to have community health workers come out of the public health division, expand COVID education, develop relationships with communities and understand what their needs are, and then match resources. For example, we had the CUDA project has been working with us on health, specifically on COVID response. Well, now that's changing a little bit too. They will now be working with the human services, and I'm not sure what their services and program will look like through human services, but I'll try to learn more about that. And when I come back, I'll try to bring more information about how that service and programming from CUDA will look like through human services. So those are just some of the things I want to share about some of the evolution of COVID, and we just kind of prepare our community, work with community partners to kind of build like a community support system in a way,
Definitely. Yeah. So again, the community is invited to continue to take care of themselves and their families by wearing a mask anytime you are outside the house. Again, go to socoemergency.org and learn where there are vaccinations available for free, where there is testing for free. If you tested at home and you tested positive or not, please report those numbers. That way there is more accuracy, because this also is information that is reported to the state and eventually, I'm sure, to the federal government. So it affects funding as well. And again, as I mentioned multiple times, if you're going to restaurants and you decide to eat indoors, please wear your mask until you get your food. And then after you finish eating, if you decided that you're going to stay there with family or friends and you finish eating, put your mask back on. That way, people who are coming in and walking around your table who may have COVID, we don't know. Some individuals are asymptomatic and therefore they don't even know that they have COVID. They are not going to spread it on you or your family members. Again, that is one of the recommendations. And then the other one is, instead of going and eating at a restaurant, if you choose to buy food from a restaurant because maybe you want to support that restaurant, go order your food again and then pick it up and take it home, take it to the park. Some individuals don't have to suffer from allergies like I do. So you go in the park and sit around and just enjoy your meal outdoors, and therefore you don't have to worry about it. So again, please take care of yourselves, vaccinate yourselves. And as always, Ms. Silvia Lemus, thank you for taking the time, being with us, and bringing all this valuable information to our
Thank you for
community.
having me, Rafael. Thank you. I'm glad I
Definitely.
was here. Sure.
You take care now.
Okay, you too. Thank you.
Bye-bye.
Bye.